Hi, I'm Joe Schweiger. Thank you for joining me on this discussion of instructional goals and outcomes. So I'm going to focus this on our more experienced paramedics, especially during our ongoing training. Instructional goals is a statement of what we want the student to do as a result of a lesson. And instructional outcomes is what we want them to learn. So kind of the more the didactic, and then putting it all together in a critical thinking form. So learned items should be able to be evaluated using various forms, either a written test or a practical. Normally we do ours in a scenario. Now, our nursing cohorts, they use, when they talk about critical thinking, they use the THINK, the think method. So it stands for total recall, habit, inquiry, new ideas and creativity, and knowing how one thinks. And I'm going to focus on that, especially in the new skill that we've been teaching, BiPAP, which is a part of our new protocols. New term for everybody, metacognition. Meta meaning in the midst of, cognition in the process of knowing, so in the midst of knowing. So it has several steps. The first one is planning. Planning is probably the most important step in metacognition. It's stating a goal. In our case, teaching the paramedics how to use BiPAP, what patients to use them on, and what the expected results should be. And then we also look at performance in the planning, selecting sequence, how this is supposed to go, from determining who, how to put it on, and how to reassess, and then foreseeing any obstacles and error and formulating plans to overcome these. And then our predicted results, either desired or anticipated. Next is monitoring. Now this looks at the steps in sequencing, and we're watching our students do these steps in sequencing and having them understand the needs of each of the critical steps. And then spotting errors and obstacles, and then coaching them through it. Now keep in mind, this is an experienced group, so they're more coaching. And encourage them to use the learned knowledge and their personal experiences. Again, we have a wide variety of skill levels from a lot of different schools here in Kitsap County, 95 paramedics. And we help them make corrections. Now, next is the assessment. Now, in assessment, we're judging first their accuracy and adequacy of their actions. And we normally kind of put this into a kind of a testing scenario, almost a discussion testing scenario. And we look for accuracy and adequacy, appropriateness of procedure, and then do they correct errors? Do they determine what the errors are? And in the end, are they able to discuss and determine effectiveness and efficiency? So how did we do this, and especially with this group of paramedics and working on those critical thinking skills? We started with, or we did, facilitated discussion. So what did we do? We first set and to explain to them the goal. We wanted them to learn how to put on BiPAP. We spent a little time in the lesson. We had to teach them how it worked. And this is a disposable BiPAP. And the IPAP, the inhaled pressure, positive airway pressure, and the EPAP, the exhaled positive airway pressure, and how that works anatomically and physiologically. Then kind of explaining the what it is, how it works, who we're going to put this on, and then what we expect, which is the patient either get better or not. So then we go ahead and we let them discuss. We give them a scenario, we have somebody run through it, and then based on their experiences, they can either make their own value judgments and corrections and help each other along. In the end, we're able to kind of then assess them individually, again using a scenario, to make sure that they understand the new protocol with this new equipment. And that's how we do our outcomes and goals. Thank you.